HIV is an acronym that stands for Human Immunodeficiency Virus. So this is a virus that attacks the T cells, the CD4 cells, that if it's not treated on time, it will emerge into AIDS. And AIDS is an acronym that stands for Acquired Immunodeficiency Syndrome. Now, for you to get to AIDS, that means that the virus has badly affected your immune system, and now you start getting the AIDS. Now, during the years when I was born in the year 1993, where HIV was really a pandemic here in Kenya. According to my research, the first case of HIV in Kenya was diagnosed in 1984 in Nairobi amongst sex workers. It was a disease so then little understood that doctors who first announced the first cases in 1984 were arrested for allegedly scaring away investors and tourists. And then in 1999, the then president, the late Moi, may his soul rest in peace, makes the first public statement in 1999 in a conference in Mombasa to declare HIV/AIDS a national disaster. Pick your calculators, guys. The first case was in 1984. And the then President Moi declares HIV a national disaster in 1999. 15 years apart. What took us so long, Kenyans? In the same year, at the same conference, the late Moi orders a creation of National AIDS Control Council, NAC, developing strategies for controlling the spread of HIV/AIDS. Thank you so much, our president. May your soul rest in peace. The late President Moi also ordered inclusion of AIDS education in schools, in the Kenyan schools and colleges. Moi also mentioned that his government would not embrace the use of condoms because that his government would not embrace the use of condoms as a deterrence of HIV, for that is going to spread sexual immoralities. I'm very sure that given a chance, if our President Moi, the then President Moi was alive today, given a chance, he would change that statement because youth are having sex. And now they need to use condoms. And the data for condom use then and now is different. So for me, that was not the best statement. He also added that such endorsement would give the youth a license to have practice unprotected sex. During the time when the first case was reported in Kenya and the time that I was born, approximately 170,000 children were living with HIV, and this number could be higher because it was not really the correct, it was not really the absolute number of children who were living with HIV at that time. Why? Because most parents were not open about their HIV status due to stigma. So the researchers would just approximate that if someone would have died out of HIV-related illness and this person has children, then these are children who are orphaned from HIV. I'm sure if my mom was alive by now, I wouldn't be out here telling people that I'm HIV positive, because most parents would not want anyone to know that they are HIV positive through their children. Their children are HIV positive through them. And that is why you find that most children are still kept at home. And that is why in those years, most children were being born HIV positive because the parents would not open up and, you know, just take their children to the hospital so treatment could be given to them, although treatment was scarce at that time. The general response of African leaders to HIV pandemic has generally been very low. And Uganda, our neighbor here, was the first country in Africa to collaborate with the World Health Organization program on AIDS to create a national AIDS program. So the success of reduced rate of transmission in Uganda was probably because the government of Uganda had embraced it early, that they already have the pandemic in the country and they have to do something about it. They created partnerships and, you know, got into it already when the rest of the African countries like Kenya here, we're still looking at each other and saying it's the Europeans who brought it to us. Where did it come from? Central Africa, from a chimpanzee, from war. People were still looking at each other and asking each other where it came from, pointing fingers when already Uganda was doing something about it. I also would love to talk about the impacts of HIV/AIDS on children my age. And when I say my age, these are children who are born between the year 1993 to date. Mostly children who would withdraw from school, probably to take care of their parents at home, their sick parents, or to engage themselves in economic activity to be able to feed their families who are already sick. Now it's the children who became breadwinners because of HIV pandemic that has made their parents bedridden. Sometimes children also withdraw from school to come and take care of their fellow children back at home, parenting them at a very young age because their parents are already sick. It has also become a burden to the extended family in case of death. When children are orphaned, these children are supposed to move in to the other family members to be able to take care of them. If my family had only 4 people who I'm able to take care of, and now I have to take care of other children from other places who are already orphaned because of HIV, that is a burden sometimes to me, and it brings in poverty. And also I have to look for other sources of income to be able to feed orphans who are coming into my house because their parents are dead. There's also psychosocial distress that is caused by the death of parents who die from HIV-related illnesses. Remember, I will always refer to my years because that's what I'm talking about. During my years, people would just diagnose you by looking at you because the media and the newspapers made HIV/AIDS look, they made the symptoms of HIV/AIDS so clear that if you're thin, wasted, and you look sick, then you're HIV positive. I remember when my parents died, I was still very young. I was 8 years old. But I was not so young to understand or see what was happening around me. I noticed that there were relatives who really feared to stay with me because they felt like they could not meet my nutritional needs, or they could not, you know, they can't stay with me because they don't understand me. They don't understand how they're going to deal with the HIV in me. What if I die? It's on records that community productivity was very low because of HIV-related death. That in most cases you find that people who are dying from HIV-related illnesses were young people who are supposed to be productive in the farms, young people who are supposed to be there to take care of their children. These are the people who are dying from HIV-related illnesses. So you find that during that year, by the way, you can do your research. During that year, between the year that I was born and now, you find that most orphans, like 80% of orphans, are living with their grandparents. Grandparents were left with the burden of taking care of their grandchildren who are orphaned due to HIV-related illnesses. So this reduced the productivity. Even in the farms, the young people who are supposed to be running around are the people who are dying from HIV-related illnesses, leaving the grandparents with the burden of having to take care of the grandchildren. It's not only the children who are born HIV positive who are infected that are so I don't know the right word to use, but my point is there are children today who are born from HIV positive parents who are born negative. They are born negative, yes, but their parents died from HIV related illnesses, and now they had to drop out of school to go and take care of their parents back at home. You can either be affected or infected from HIV. I am infected. I am HIV infected. That means I have HIV running through my blood. And you, who as a parent who is HIV positive, who as a sister who is HIV positive, who as a brother who is HIV positive, who as a friend who is HIV positive, you are affected. So this is the equalizer. You are either infected or affected. So we are all involved in this. So don't run away thinking that this is not your topic. It is. Both of us, we have to come together to fight. Okay? Yeah. Let's remember not to fight people with HIV, but fight the HIV itself. So what was I coming to? I was coming to tell you that there are children today. They might not be able to talk about it because we still have stigma. In 2022, it's still very hard to be HIV positive here in Kenya. But I have talked to friends who had to drop out of school. I will not mention that I have, they might not be my friends, but there are people I know. Because me being HIV positive and talking freely about my status out there to people, I get stories. People talk to me, people open up. People come, let me tell you my story. Let me tell you my story. This is my story. This is what happened. And I have heard stories of a young lady who had to drop out at class 8. Why? Because she was going home to take care of her mother, who was bedridden due to HIV/AIDS. So she had to drop out. That is a big challenge. She is affected. And it happens. Sadly, even today. How many years later? 40 years later. I might not end this video without talking about property grabbing. Most husbands died and left their wives at home. And because of our retrogressive cultures that a woman cannot inherit their husband's properties then, not now. Most women were chased away from their homesteads with their children because their husbands died from HIV-related illnesses. And now you are excommunicated just because you are looked at as someone who is going to bring a bad omen to that home. Children became homeless. There's a study that shows that between 1999, when AIDS was declared a national pandemic here in Kenya, there was an increase in street family and especially children. And these children, if you follow so well, you will find out that these are children who are orphaned by HIV/AIDS. It is a great pandemic, you guys. It is a great pandemic. Because of my African culture, I'm wondering, if my parents did not die, I would have a roof over my head. HIV/AIDS. I have been deprived of my inheritance rights because I'm a girl and because my parents died of HIV-related illnesses. Can you imagine if they were there today? The pandemic. And that brings me to saying this. If you're watching this video and you are being denied your properties because you are a woman, because you are a girl, or because you are a young boy who is HIV/AIDS orphaned, your parents died from HIV-related diseases, Now we have organizations that would fight for you. We have organizations like KELIN. KELIN is the Kenyan Legal and Ethical Issues Network. This was a network that was formed way back in 1994 and registered as a non-governmental organization in 2001. It basically advocates for the rights of orphans who children who are orphaned HIV-related illnesses, widows, young ladies. So, know your rights. Gone are the eras where people were being excommunicated because they're HIV positive. Gone are the days when children were being sent away without inheritance because they were HIV positive, or because their parents died from HIV-related illnesses. So that the parents who died from HIV-related illnesses or alleged HIV-related illnesses, their kids would be exposed to a lot of stigma. 30th December 2002, 11 a.m. President Kibaki becomes the president of Kenya. Let's look at what he did. The late Moi did not do so much in terms of HIV, even though he declared HIV a national disaster, but there was very little that was done towards preventing the HIV from clearing our community. When Kibaki becomes the president, he declares a total war against HIV and asks the NAC, National AIDS Control Council, to work with the other ministries so that they could look on better ways in terms of reducing the number of people which was estimated as 500 to 700 people dying every day, and at least 5 people dying every 5 minutes. That is ridiculous. Let me read this out. According to the KNH morning briefings, in order to address the pandemic, Kibaki has already communicated the government to subsidize the treatment of 40,000 HIV/AIDS patients and abandoned the former president's Arap Moi self-described shy policy about condom use. The Post report, Kibaki has said he supports condom use and promotion of abstinence until marriage, adding that if the AIDS problem is not addressed, none of his government's other programs will matter. The Kenyan President Mwai Kibaki comes in and declares a total war against HIV/AIDS, which was killing an estimate population of 500 to 700 people daily. At this time, remember Moi had declared HIV/AIDS a national disaster back in 1999, but there was no clear way, there was no clear strategy of preventing the disease or for treating those people who are contracting it. Remember, the population was still growing at this time. African leaders are still looking at each other. They are still declaring national disasters. They are still declaring a total war. But what is being done? The government of Kibaki encouraged condom use and promoted abstinence as a way that would curb the spread of HIV/AIDS here in Kenya. In addition, Kibaki also requested the church leaders to spend the first 15 minutes to talk about the ABC rule of HIV prevention that involved abstinence, be faithful, and use condoms, which was still thrown away by some religious leaders because they did not believe in use of condoms. African religious leaders. While this was working so well in our neighbors, Uganda, the use of condom was working so well, and the promotion of use of condom by religious leaders in Kenya was not working at all. Actually, they're the people who are were questioning it. What we must all agree on is that our Kenyan leaders took a lot of time to develop strategies in preventing the spread of HIV in Kenya. But also, we must give them credits for each and every president did something. It didn't have to be something very big, but they did something. Our then Kenyan President Mwai Kibaki was so committed to see that the treatment for HIV goes uninterrupted. On the 43rd celebration of Madaraka Day, Kibaki's government declared that ARVs now will be free in Kenyan public hospitals. Wow. I feel like Kibaki's government was really declaring the war against HIV. But there was still a problem. Now, if Kisumu was, I'm talking about Kisumu because I stay in Kisumu and I'm a girl from the lake. So if Kisumu was the main town in Nyanza, where you were supposed to come and take your ARVs, they used to charge 500 shillings. That is around $5. You are supposed to travel from whichever place. Let's say you're traveling from Nyakach, if you know where Nyakach is, to Kisumu every month to come and collect your ARVs. You are supposed to pay 500 for that ARVs. Okay? And there are people who cannot afford it. It was expensive, so they resort to staying home and dying in peace. But our lovely president, the then President Kibaki, said that now ARVs are going to be free. But then there was a subsidy that was supposed to be given in terms of for the drugs to work well. There is monitoring that you have to be done for. Then they used to collect the CD4, and for them to buy the laboratory equipment, they have to use money. So the government also created a subsidy on the laboratory equipment so that you take your ARVs and also you'll still get to have your CD4 taken, so that we monitor how the ARVs are working. So yeah, the government of Kibaki did a lot more that I might not know all of them. So if you know some, kindly comment down below and let me know. The government of Moi hushed the situation of HIV here in Kenya so much that they just ceased the hushing somewhere in 1990 when generations were being wiped away. Believe you me, quote me anywhere, each family has someone who died of HIV-related illnesses here in Kenya. People died. 100,000 people died daily before this mzee could think of declaring HIV a national disaster in 1999. ARVs were not available until 1996, and that confirms why most of our parents died from HIV-related illnesses, and most people died again even after the introduction, because it was only free in 2003. Yeah, it's only in 2003 that our President Kibaki declared that ARVs were going to be free. So this confirms why most generations were swept away at that time, because they were not able to afford it. I don't know why this thing is annoying me. A lot more happened. The access to HIV medication was more easier now. It is Kibaki's government that ordered testing guidelines, HIV guidelines for HIV positive patients. Uhuru Kenyatta comes in to presidency. I might not be able to mention everything, but I'm just trying to mention the snippets of things that I have gone through and I'm sure about, and I can back up information and I can back up the information that I'm giving you. But the truth is that most of our African leaders really tried, even though there was a little bit of negligence and rubbing of shoulders when HIV was just, it was a new thing. Everyone was shocked. Everyone was, where do we start from? President Uhuru Kenyatta was really particular about HIV in schools. And during his speech here and there, he would really encourage teachers to bring in the HIV/AIDS education in schools. One time in his speech, he mentioned that the young girls should stop having sponsors, for this is how HIV/AIDS is being transmitted mostly. He acknowledged that the country has made great strides in the fight against HIV. And that is the truth. President Uhuru Kenyatta reorganized the National AIDS Control Council to cover more diseases beyond HIV, which is a good thing, because right now we might be considering all efforts are on HIV, and we forget that people are dying from COVID-19, the newest disease right now. So the president just restructured the National AIDS Control Council. It is during your reign, President Uhuru, that we started having shortage of ARV. My inner feeling about Uhuru's government is that Uhuru Kenyatta's government had a lot of policies, a lot of good strategies in terms of prevention and fight against HIV that did not come to pass. It is in Uhuru's government that during a meeting in Nairobi, Uhuru said that now the country is in a position to start manufacturing our own ARVs. That must have gone with the water. I'm yet to find out. Uhuru's government really worked hard toward the efforts to maintain the policies that were made by the Kibaki's government, to maintain the ARVs being affordable and free in public health hospitals, and also purchasing commodities, the HIV-related commodities. I was much adult enough in Uhuru's government, so I'm able to point out a few things even without doing research. I'm able to know that medication for the young children was almost introduced in the Uhuru's government, and he was so particular about infection prevention to the young children and adolescents. He also embraced the use of condoms and encouraged abstinence in adolescents. In 2021 and now, there's always shortage of ARVs in Kenya, where patients have to be given a month worth of ARVs, and they have to be returning to the clinic every month because of shortage of ARVs. Patients cannot be given 3 months worth of drugs that they're always given, so that they don't always come to the hospital. Remember, during this time when there was COVID-19, most patients were not allowed to come to the hospital, like to group there ati wamekuja kuchukua ARVs. No, that they have come to take the ARVs. What was happening is that stable patients with stable viral loads were given ARVs worth of 6 months, and their viral loads monitored in between. During the COVID-19, there was a shortage of ARVs, and most patients had to come back to the hospital after every month. This was demoralizing for patients who are coming from far away, and they had to use money to come to the hospital every other month. Most people stopped treatment. Trust me. Most people lost their jobs because you cannot ask a Muindi for offs every other month. Or your employer cannot see you going off every other month. Because again, you don't want to tell them that you're going to take your ARVs. It's stigmatizing. Adolescents in schools had to ask for permission every other day to walk out of school to go to the hospital. They stopped taking their ARVs. And their viral load rised. Some of them died. Shortage of ARVs. In 2020, 2021, and in 2022, there is still looming shortage of ARVs in Kenya. What is happening? What is the allocation of ARVs? Because if they are free, that means that there is a global fund for ARVs. Here is the problem. We have tumbocrats in Kenya. We have a lot of corruption in Kenya, that if money comes in that is allocated for the HIV and ARVs commodities, there are people who are still so corrupt that they mismanage those funds, that now the US aid is not able to give us the aid because they don't trust us anymore with the funds or with the ARVs. They now sell ARVs. Backdoor. They make themselves rich with commodities that are supposed to come in to help people like us who are HIV positive. So now, KEMSA has been on the limelight all the time for corruption with HIV-related commodities. So UNAIDS are not able to release the ARVs to them because they are not trusted. Someone was supposed to be arrested from KEMSA. Has that been done? So that means the USAID is still not going to trust us with this. So someone somewhere up there is corrupt. Yes, us, we are suffering down here because we need the ARVs to survive. I have a few questions to wrap up the conversation. Are we really ready as Kenyans to manufacture our own ARVs here in Kenya if we still have to fight and run around with leaders who have taken HIV money for their own personal benefits? Are we ready?